The health department is still not declaring community transmission of the Delta variant, despite cases of the more infectious strain breaching 200. To tell us why, we have Greg Gregorio now reporting to us live from Mandaluyong. Good afternoon, Greg. Why is the DOH still not going ahead and declaring community transmission of the Delta variant?
Charles, according to Health Undersecretary Maria Rosario Vergere, there is still no evidence for us to declare a community transmission of the Delta variant here in the Philippines. Community transmission would mean cases without linkages to each other. But according to their phylogenetic analysis, they are still seeing linkages amongst our local cases, which is a sign of a local transmission. But even so, according to Vergere, we may act as if there is already a community transmission of this variant in the country for us to have a better or more cautious decisions or actions here in the country amid the threat of the Delta variant. Charles?
All right, Greg, could you break down for us the numbers? How many Delta cases do we have now, and how many of these are still active?
Charles, as of the latest biosurveillance report of the Philippine Genome Center and the Department of Health, we now have detected 216 Delta cases here in the Philippines. 192 of them have already recovered, 16 are still active, while 8 have died. Out of these 8 individuals who have died and positive with the Delta variant, 6 are local cases and 2 are returning overseas Filipinos. Charles?
Right, Greg, let's talk about the biggest story for today, I suppose. What does the health department think about the NCR now reverting to ECQ?
Charles, according to Vergere, they have agreed for the implementation of enhanced community quarantine over the National Capital Region from August 6 to 20 because this is following the projection of FASTER, which is part of the IATF data analytics, projecting increase of cases if we will just implement general community quarantine with heightened restrictions over the next coming weeks. According to Vergere, implementing enhanced community quarantine would help prevent or delay the further spread of the virus over the National Capital Region. Charles?
Hey, Greg, Metro Manila mayors are hoping to get a bigger allocation of vaccines for NCR. Specifically, the number they have in mind would be 4 million doses. What does the DOH have to say about this? Is this enough?
Charles, according to Vergere, the NCR may be given 4 million doses of vaccines as the Metro Manila mayors have requested because according to the geographic consideration under our vaccine prioritization program, NCR, as considered as an epicenter, may be given a bulk of the supply of vaccines. And Vergere said vaccine Sar Carlito Galvez Jr. has also stated that we may give these doses of vaccine to the National Capital Region, but then again they would still have to discuss, as even though we are expecting millions of doses of COVID-19 vaccines in the coming weeks, we still have to allocate doses to other provinces in the country, especially that we are also seeing increase in cases in various regions in Visayas and Mindanao.